you don't really know who you are or what you are until you put a really big challenge in front of you.
Fear is an asset and ally here to help you be magnificent.
This crazy, silly, stupid idea to run across the Sahara Desert.
You did make it this time, but you said if you didn't make it, you would try again and again.
Everybody's connected to nature, connected to music, to their families, and now we're going to build a world that doesn't have racism and war and starving kids.
I kept telling myself, run at me, and just keep smiling.
All right. Stacy, Stewart, nice to meet you.
Nice to meet you too. Great to be on with you.
So can you please, it's a Friday afternoon. It's a little rainy here in New York. I'm in the Gramercy area. Can you please paint a picture for our members where you are right now?
Yes, it is about what it's like in New York is what it's like here in Washington, D.C. I'm actually in Bethesda, Maryland. It's a Friday afternoon, a little bit drizzly, basically overcast, but it's a nice day for a walk. How about that?
Yeah, it's good to get a little fresh air these days, isn't it?
Like every day I have to get out of the house because if not, you just kind of go crazy. Just the staying at home, working from home thing is kind of a new thing for me. We have a lot of people at the Marchof Dimes who do work from home, but we just moved into a new office in Washington, D.C., and I kind of like going there, but not now. So
yeah,
we're all getting used to a new thing now.
Well, you've been walking a lot of charity miles, I'll tell you that. I see them on Twitter. I see when you post. You've done like over 100 charity miles already.
Actually, you know what? I'm on my walk right now, and while I'm on my walk, I will reach my goal. So sometime during this podcast,
that's amazing.
I'll get to celebrate and raise a bunch of money for Marchof Dimes too. So it's great.
There you go. What is your goal, by the way?
Well, my overall goal personally was about $10,000. I was doing some fundraising before I signed up with Charity Miles. So this is just adding to it, right? So yeah, but it's been
amazing.
Great. It's been great. Awesome. And I'm walking
so you're
with
not
my
only
daughter,
walking
by the
to
way,
raise money. Oh, nice. How old is your daughter?
She is 15. She's a ninth grader. Yeah, so she has to get out of the house too because she's been distance learning. So it's good for her too.
Yes. Yeah. And so you're not only walking to raise money for Marchof Dimes, you are the CEO of Marchof Dimes, which, by the way, we are just so honored to be working with you. You are like the March of Dimes. Like what we do is you planted those seeds 80 years ago, the whole idea of walking, marching for charity. And, it's just such an honor to be partnering with you and to be working with all of your team. It's just they're great to work with. And so we're really grateful and just wanted to thank you personally for that.
Thank you.
Can you maybe share with our members who don't know as much about Marchof Dimes some of the legacy? I mean, you were founded back 80 years ago with regards to polio, but you kind of done a lot since then.
Exactly. It's kind of interesting. We were founded, we're over 80 years old now. We were founded by President Roosevelt as the organization that would help raise the money to fund the research that eventually led to the vaccine for polio. Sorry, I was going up a pretty steep hill, so I'm a little winded. And
a
lot of people, I think they know President Roosevelt was, had contracted polio himself, but polio at the time was really a a virus that primarily affected children. And, you know, a lot like it is now during COVID-19, another virus, not sure how you get it, highly contagious, that was polio. And it was also very terrifying. So a lot of parents, a lot of people like they are today are really afraid, you know, and that was certainly true. And even during the times of polio, we had periods of time, especially during the summer, when public facilities were closed, theaters were closed, swimming pools were closed because parents thought maybe their kids could get polio through swimming. You know, again, just not knowing exactly how we got it. So we even have pictures of like people sending dimes into the White House, and you know, people opening up all of these envelopes full of money, and all that money went to fund very important research by Dr. Jonas Salk. So yeah, so we have a really amazing history, you know, and you know, it's amazing.
I did not know all of that history.
Yeah. Oh yeah.
And how relevant it is now.
How relevant it is now. I mean, we're seeing so many stories now about polio and how the country pulled together back then, you know, to address the polio issue. Of course, polio went on for years. You know, it took many years for Dr. Salk to develop the vaccine. And many hundreds and hundreds of thousands of children that were involved in clinical trials and things like that. But it is probably one of our greatest health challenges that this country has faced and that we've solved. So it's great to like lead an organization that's like taking on a big public health challenge and solved it, right? We know we can do it.
Right. That's amazing.
It is cool. It's very cool.
But then you solved that problem, right? Like there is a polio vaccine, and obviously polio is, you almost never hear of anybody having polio anymore.
Right.
So you started taking on other missions with regards to maternal health, and you've been doing amazing things there. Can you share a little bit more about, you know, how that developed?
Yeah, sure. So, you know, so polio is no longer an issue. We've essentially eradicated it here in this country, and it would be eradicated around the world, but for access to the vaccine, especially in emerging countries. But, you know, there's still lots of folks working on that. But once the issue got kind of addressed here in the U.S., you know, the organization was still in place, and there was a recognition that children, especially, and babies, were still being affected by a lot of other things, you know, birth defects, and then and our attention, you know, in the 60s, 70s, 80s really turned, and even into the 90s really turned to birth defects. And then we've also turned our attention now to one of the leading issues facing babies, especially, and that is premature birth, which is the premature birth and the consequences of premature birth are the leading causes of death for children between the ages of 0 and 5. And so that is our focus, and has been over the past, you know, decade and a half or so. And we've even gotten very clear about premature birth, recognizing that even a lot of premature birth is also stemming from the health of the mom. So today the March Dimes is very focused on not only healthy babies, but healthy moms too.
And I was reading from you, and just since we've been working together, I've become more educated on this issue. And I was so surprised to hear this, that the United States is one of the least safe countries to give birth, to be pregnant in and give birth in. Is it? How is that possible?
Yes, exactly. It is absolutely shocking. One of the wealthiest countries in the world, if not the wealthiest, to have some of the worst outcomes of any developed nation in the world with respect to maternal health. So you're right. Today, the U.S. is considered the most dangerous developed nation in which to give birth. We have a maternal health crisis in this country for women generally, but especially for women of color. Every day, 2 women die as a result of pregnancy and childbirth, somewhere between 700 and 900 women a year. And while those numbers may not sound significant, they really are. Our rates of maternal health and
They sound
maternal
significant to
death,
me.
they sound pretty significant. Any life we lose is precious. To think 700 to 900 women die every year because of pregnancy and childbirth is just, unacceptable. And one of the things that we find is that our rates of maternal health are not distributed equally across our population. We have Black and brown women, especially African American women, who die at a rate of 3 to 4 times that of white women. We know that the issues are not tied to income or education. In fact, an African American woman who's highly educated with access to healthcare is still more likely to die than her white counterpart. So when you
Really?
strip away, yes. And so when you strip away all the factors, it is pretty clear that race and racism, I should say, has a lot to do with why we see this disparate outcomes. And that's a lot of our work, is making sure that every mom is healthy, but especially making sure that we deal with these racial inequities that exist as well.
Can you explain, because, when you were first saying that, I was thinking like, well, not in a good way, but I can understand why that would be, that, women of color, same thing like here in New York, like with the COVID stuff, like people of color are disproportionately affected by COVID for all of the reasons that you might suspect. Like, it's just systemically, there's like systemic racism that, they don't have access to the hospitals that they have access to aren't as great. Their entire like health system forever is not as good. They're not, they've got more diabetes because they live in food deserts and, all the things that you would think. But you're saying that even like the Black women who are educated and like live in healthy areas and things like that, and income, like that's not what's causing it. It's just a racism. Or like, what are the factors that are causing it?
Yeah, I mean, so
if you
there
take out the
education
and income and things like that.
Right. So look, all of what you talked about contributes. All those things contribute to the disparities that we see. I mean, obviously, women who are living in conditions where there's inadequate housing, where there maybe lack financial stability, there's income insecurity, living in food desert, all those things exacerbate anybody's ability to maintain their health and wellness. What we see is that disproportionately people of color are the ones living in many of these conditions, right? So, of course, the impact on their health is even greater. And COVID-19 did not create that situation. COVID-19 really stripped the layers off of exposing what these disparities really look like, because it exposes them tremendously. And now we see that even in the midst of a time when we're not in a pandemic, we're already facing, extreme outcomes that are really unacceptable. What we're worried about the Marchof Dimes is that this pandemic is simply going to exacerbate what was already a terrible situation, especially when you look at outcomes for moms and babies. And that's what we're focusing on. And we are seeing that play out. We are seeing the disparate impact of the pandemic in communities of color. There are many stories of moms who are not only dying because of the COVID-19, but they're dying because of the inability for the healthcare system to recognize their symptoms, to respond to them. There are plenty of stories, even in New York, a young woman who just died showing up at the hospital because she, an EMT thought that she was having a panic attack and she had COVID-19. She could not breathe. And they did not treat her at the hospital, turned her back. She had to come back and she died. There are lots of these stories. And we're not blaming, the healthcare system. Look, the healthcare system is stressed beyond belief. And people are working unbelievable hours and the impact on our healthcare workers is extreme. Having said that, we do need to be aware of the fact that COVID-19 doesn't discriminate against anybody. It'll attack you irrespective of your race, your income, your education level, doesn't care. So what that means is that everybody, irrespective of their race, their income, and their education level, needs the same level of care. And unfortunately, we're not seeing that in too many cases. And that's one of the things that we want to call out, because we think the healthcare system really needs to be strengthened in areas that allow for implicit bias to not be a factor in the delivery of healthcare. And unfortunately, I'm sure one different health crisis that we were already facing, based on research and studies, we were seeing quite a significant amount of implicit bias affecting outcomes for moms and babies, especially women of color, but babies of color, and especially African American moms and babies as well. Sorry.
And so how is the implicit bias? It's all good. We like that. We like to hear usually when I do these, it's in person on a walk or a run. And, we like to get the sounds of the lawnmowers and the cars and the trucks, and it adds like the flavor to the podcast, lets you know where people are.
Right.
So how is the implicit bias playing a role in the maternal outcomes, not the COVID-19 outcomes, but, we were talking about how, women of color are having these significantly worse outcomes. How is the implicit bias causing that?
Well, we talked about just different social determinants of health impacting communities of color disproportionately, right? So far too many people of color end up living in these areas that really don't serve them well in terms of helping them maintain good health. But there is research and there are studies that show that even when Black mothers sometimes present to a health care provider, a clinic, a hospital, sometimes their needs are not responded to in the same way that others get a response. So, for example, a Black woman who may be having elevated blood pressure, for example, and she's pregnant, if there's an assumption by the healthcare provider, well, lots of Black women have hypertension, so this is not unusual. Well, it doesn't mean that it may be unusual for her. She may be a Black woman who does not have hypertension, but might have developed it in the course of her pregnancy. And irrespective of whether or not you think it's just a normal condition, if she's got elevated blood pressure, it has to be addressed. And so the CDC has actually said that of all the maternal deaths that happens in this country, about 60% of it is preventable. It's preventable by healthcare providers who don't delay or ignore or don't provide the right diagnosis, don't provide treatment in a timely way. If those things can be better addressed, we could probably prevent about 60% of all these cases. And of course, this is pre-COVID-19, right? So this isn't just me saying this. I mean, the CDC has looked at this. There are reports, and a lot of us that are focusing on maternal infant health are very focused on what's broken in the system and how do we fix it. One of the things that Marchof Dimes is doing is we've just launched an implicit bias training for healthcare workers and healthcare providers in hospitals, so that people can recognize their own implicit bias. So all of us have some kind of implicit bias, right? But to the extent that our implicit biases stand in the way of appropriate and high quality healthcare, we need to understand what those biases are, what they look like, so that we, can address it. And so that more women, their lives can be saved and their babies can be growing up with their moms as opposed to without their mom.
It's interesting because when you think about, the polio problem was a scientific problem. You solved that with a vaccine, but this is a much more of a social justice problem than a scientific problem, or at least in the way that I'm hearing it now. It's more of a systemic problem.
Right. I think it's a combination of all those things, right? It's a problem that, to the extent that there's some underlying health conditions that lead to premature birth or poor maternal health, what can science do to help us better understand what treatments might be available to women and their babies? Then, to your point on systemic failures, we certainly need to make sure that policy solutions are in place to make sure we have a policy environment that promotes good health. And then we do need to look at these larger societal issues where other kinds of challenges show up for people of color and it impacts their life. For example, we did research, I guess a year and a half ago, and uncovered, just like we've talked about food deserts, maternal care desert. And these are counties in the country that don't have a hospital that offers obstetric services, no OBGYN, no certified nurse midwife. And about 30% of all counties are like this. And there are a lot in rural areas, but also in urban areas as well. So those are some of the things that, if this is how women are living, we've got to figure out how we change some of these so that the impact of a lack of access to care doesn't create poor outcomes for them, especially when they're ready to deliver their baby.
So what can be done about that in rural counties, like other than building more hospitals, which probably is a much bigger task than can be accomplished because, you know, that's just the nature of living in a rural county, is everything is so spread apart.
Right. So that's the kind of interesting thing about the COVID-19 pandemic. Sorry, I'm trying to catch my breath too. I got a hilly neighborhood. I didn't realize how many hills are around here.
I've been in Chevy Chase. There's definitely some hills there.
It's pretty hilly.
A friend of mine used to live in Chevy Chase on Cumberland, and it was I remember it being a steep hill.
Oh yeah, exactly. So that's one of the interesting things about COVID-19. We're finding that because so much of everything we do has been virtualized, including healthcare delivery, right? Where so many doctors are doing many more telehealth appointments and things like that. We now understand that telehealth is not necessarily a panoply for all of our healthcare, addressing all of our healthcare needs, but it could be the next best thing if you're a pregnant mother and it's 100 miles to get to a prenatal visit. I mean, the likelihood that she's going to be able to make it to every one of those prenatal visits, especially if she doesn't have ready access to transportation, it's very difficult. So, you know, I think what we're finding is that, and if there's a silver lining in this pandemic, we're going to all stretch ourselves in the system to really be using technology more effectively. Now, you know, again, it's not a silver bullet, and we have to recognize that people in rural areas, low-income people, even in urban areas, may not have access or the bandwidth. But but it is an option, right, for many women to reach women where, and from all of what we're seeing so far, women are very, very open to it. They're responding to it well. So I think out of this pandemic, we're going to see us turning to telehealth, telemedicine in ways that, you know, we'll never go back to the old ways of doing it. So that's one of the things that we can do, but we have to address the policy failures, right? I mean, we have to address the fact that, you know, over 40% of all births in this country are covered by Medicaid. That's something a lot of people don't realize. And if 40%. You're a woman, yes, over 40%, between 40 and 50%.
Wow.
And it's quite significant. Medicaid is a huge factor in how we're going to change the trajectory on maternal health. Well, what happens under Medicaid And of course, things vary state to state. Is for the most part, if you're a woman, you weren't on Medicaid before you were pregnant, but you're able to get on Medicaid during your pregnancy, you often will get dropped within 60 days after delivering the baby. And what we know about maternal death is that about a third of all the deaths happen 7 days after childbirth out to a year. And a lot of times it has to do with chronic health conditions that the mom is facing. There may be substance use issues, but what happens is that if women all of a sudden do not have health care, they were dropped from Medicaid and don't have access to health care other than that, then how are they going to go to their follow-up visits for a doctor to manage their, heart problems or blood pressure problems or whatever problem? I think I'm back. Can you hear me?
Yep, you're back. I lost you for a second.
Okay,
though.
sorry. I went through a little tunnel.
All good.
So my point is that these are some of the policy fixes. So making sure Medicaid can be extended 1 year postpartum, right? So that mothers can maintain their health, especially if their health somehow deteriorated during pregnancy, right? There's also other things we need to do as well. I mean, the implicit bias training that we're implementing at the Marchof Dimes really needs to be embedded into medical school programs across the board. I mean, there are plenty of reports that show how medical school students are still being taught, or somehow there's some belief by a lot of doctors and even folks in the system that somehow people of color don't experience pain in the same way that others do. And yes, I mean, I don't know how I'm not going to say that it's explicitly taught, but there have been studies, and there certainly was a period of time when that was the prevailing belief, right? And how that has continued as sort of a prevailing belief, decades later, is a concern, right? Again, these are things that are not based in fact, but need to be corrected and need to be, addressed. So right now, Congress passed a very important piece of legislation at the end of 2018 called the Preventing Maternal Deaths Act. And that helped to create what are called maternal mortality review committees to collect the data needed to ensure that we understand everything we need to understand about maternal death. That was very helpful because without the right data, it's hard to design the right interventions. But now Congress is considering even more legislation to do these things that I'm talking about, like extending Medicaid, expanding access to resources to address implicit bias and many other issues. And that's something that Congress, hopefully, obviously the focus right now is on the pandemic, as it should be, but it's something that Congress needs to keep front and center, because the maternal health crisis has not ended because we have a pandemic. So, yes.
Right.
So,
I've been, that's actually a point that's worth mentioning, by the way, is, I've been saying that COVID did not cure cancer, and it didn't end global warming, and it didn't protect animals, it didn't cure Parkinson's, and it didn't stop the maternal health care crisis. And as much as we all need to be, very focused on COVID right now, we also need to be we can't lose sight of all the other things that are important as well.
Right.
And,
exactly.
That's one of the reasons that, I'm really proud of our community, because we actually just did a survey yesterday, and I was very, very surprised by the results. We did a survey, we sent it out, and we said, have you donated to charity? And almost everybody said that they donated to charity. And then we did a second question. So I wasn't, surprised by that, because our members are very obviously charity minded.
Right.
But I was surprised, because I thought that, most people would donate to a COVID relief charity, because obviously that's front and center, and like everybody. And so, not surprisingly, everybody did donate to a COVID relief charity, either, first responders, healthcare workers, food banks, things like that. But they have also been very, very philanthropic to their their other charity models, charities that aren't necessarily you know, the COVID relief charities.
Yes.
And we need,
Yes.
I was so happy to see that because, you know, our charity partners, you guys, they need it right now more than ever.
Yes.
The work that you
More
guys
than
do is
ever.
just so important. It's always important, but it's important now more than ever.
Well, and it's been really important, Gene, to partner with Charity Miles. Let me tell you, you know, a significant amount of the revenue for March of Dimes, we pioneered the walks that raise money for charity. This is our 50th year.
March of Dimes.
Yeah. Pioneered medical research for polio, pioneered a walk, and now every single walk you participate in every weekend, you can thank the March of Dimes for giving your organization, your charity of choice, that idea in the first place. So we have hundreds of March for Babies events that happen between March and May every year. It's a huge source of revenue for us every year. And again, this is our 50th year, big anniversary, and then the pandemic hits. And in February, even before sort of the national state of emergency and lots of stay-at-home orders, we decided we need to pivot. It was pretty clear having large groups of people gathered was not going to make sense. And we're a public health organization, so we have to, we have to really care about that. And my team reached out to you guys to say, how could we use Charity Miles app to help us during this time? We already had a kind of fundraising engine internally that had been built that a lot of our teams were using to raise money, but it just seemed appropriate that if we're the March for Babies, that people ought to still be out and do their walks like I'm doing, today, being socially distant and all that, but also use this time to raise money. And we're just, we're thrilled by how people responded to it. We see engagement being even higher. I think people are very generous at this time. But the challenge with charity right now is, even though people want to be very generous, some people can't. I mean, our employment numbers just came out today, and we're in double-digit unemployment right now. It's just not possible for a lot of people. So giving individuals an opportunity to expand how they do good in the world has been amazing. And it's really been a lifesaver for us, really, honestly. It's been great.
Well, we're honored to be working with you for sure. And, you talk about, you guys pioneering the whole walking for charity. One of the things that I really love about you is that you are not the walk of dimes. You are the march of dimes.
Right.
And, we had a member, and his name is Noah. We have a member. His name is Noah Barnes. I think he's 13 now, but when he was 11 years old, he marched from Key West, Florida, to the northwest tip of Washington State, 4,300 charity miles.
Oh my goodness! Wow.
And he has type 1 diabetes, and he had this. He was, he never did any marching or like walking or running before that, but he had the idea that he wanted to do it. Convinced his parents. His dad marched with him. His mom and younger brother and younger sister packed up a Jeep and drove along with them. And he called it Noah's March. And I asked him, I said, Noah, why do you call it Noah's March? And this 11-year-old boy, he said, because I've got a mission and a purpose, and soldiers march.
Wow.
And I just think of that. And I think that, you guys, you have a mission and a purpose, and you are the March of Dimes, and we are just so proud to be marching with you. And again, I just want to thank you and your team for being so great to work with and giving us this opportunity to rise to the challenge in this very sacred moment. So thank you very much.
Well, thank you so much. And there's still plenty of time for people, if they want to be a part of it, to sign up at marchforbabies.org. Our March for Babies Step Up is all about taking those steps and marching for babies and doing good while you're also trying to stay healthy during these very challenging times, which is really important.
Right. And actually, to that point, I'll say, there is plenty of time. I mean, we obviously want to get a lot done before May 15th, when the kind of the March for, is it May 15th that the March for Babies campaign kind of culminates?
Yes. And we've had like Eli Manning at our kickoff, and we've had Jay Wright, who anybody's a Big East college basketball fan, Coach Jay Wright from Villanova has been a part of kind of cheering on our teams. And so we have a big celebration on May 15th. So there still is time, and we're going to be collecting money even after the May 2, but our big celebration is May 15th.
Yeah.
So,
so May 15th, I'm thinking of it, that's like a commencement date, right? Like that's like the graduation, but the commencement date, they call it commencement because that's not the end, it's the beginning.
The beginning.
And we're just getting started with you.
That's right.
We got a lot of work ahead, and we're not stopping at May 15th. That's the commencement date, and we keep marching from then on. So we're just getting started. There's a lot of good things to come.
Started.
And there's a lot of work to do. So actually, with that, would you have any calls to action for our members who are, walking and running along with us right now?
Well, we just want everybody to remember that, there are a lot of things we can delay during this pandemic. You can put off a softball game or March Madness or whatever else is going on, but a woman that's pregnant today cannot call off her pregnancy. And the scariest thing for a lot of women right now who are pregnant is having to deliver in a hospital in the midst of a pandemic. So we really want everybody to remember that pregnant moms are very much considered a part of the vulnerable population with respect to the pandemic. Mm-hmm. Babies are not immune to contracting COVID-19, and we're just trying to do everything we can to protect them, and we need everybody's help. So, sign up with the Charity Miles app, go to marchforbabies.org, and be a part of this movement for moms and babies. That's the biggest thing.
And there's probably going to be a lot of babies delivered in 9 months from now.
I think so too. I don't know how many, but I'm kind of guessing that quarantine.
We could be needed even more.
Yeah, exactly. And that'll be a great thing. Yes.
So anyway, Stacey, thank you so much for walking along with us right now, being a trooper, getting out there in the rain with your daughter, going up the hills, and for sharing so much with us. And thanks to everybody out there for walking or running along with us. Every mile matters.
And thanks, so glad you could be with me during my 100. So glad you could be with me when I reached my 100th mile. So thank you.
Yes, 100 charity miles. There you go.
That's right.
It's a big milestone. I got a T-shirt for you. You earned a 101 mile club T-shirt.
There you go. Well, thanks, Gene. I appreciate it. Thanks a lot.
Thank you, Stacey.
Okay.
Take care.
Take care.